Ever wondered why heart disease is often referred to as a silent killer? This lethal moniker is earned because heart disease can stealthily progress, undetected for years, even decades. Alarmingly, it's the leading cause of death worldwide, emphasizing the crucial need for awareness. Knowing the signs is the first step towards early detection and prevention, potentially saving countless lives. So, what are these signs? Stay tuned to find out. First up on our list is unusual fatigue. Ever felt exhausted for no apparent reason? This could be a sign you shouldn't ignore. It's interesting to note that unusual fatigue can be a significant indicator of heart disease, particularly among women. Now you might wonder, why does this happen? Well, when your heart isn't functioning as it should, it struggles to pump blood efficiently throughout your body. And when your body doesn't receive the oxygen and nutrients it needs, it can leave you feeling constantly worn out, leading to an overwhelming sense of fatigue. It's not the everyday tiredness you might feel after a long day's work or a strenuous workout. No, this is a persistent, nagging fatigue that doesn't seem to let up, even with ample rest. So, remember, if you're experiencing unusual tiredness, it might not be a simple case of needing more sleep. So, if you're feeling unusually fatigued, it might be more than just a bad night's sleep. Next, we have chest discomfort, often mistaken for indigestion. Ever experienced a strange discomfort in your chest? It's easy to brush it off as heartburn or the result of that extra slice of pizza. However, if the discomfort is located particularly in the center or left side of your chest, it might be more than just your guilty pleasure talking. This discomfort can take various forms. It might feel like an unusual pressure, as if an elephant decided to take a seat on your chest. Or perhaps it's more of a squeezing sensation, like your heart is caught in a tight grip. At times, it might even manifest as a feeling of fullness or an unexplainable pain. It's crucial to remember that these sensations aren't necessarily sharp or extremely painful. They can be mild and easily mistaken for indigestion. So, the next time you feel that peculiar chest discomfort, pay attention. It might not be your lunch, but your heart calling for help. Third on our list is shortness of breath. Do you find yourself panting after climbing just a flight of stairs? This might be more than just a sign of being out of shape. It could be an indication of heart disease. You see, your heart and lungs work as a team, delivering oxygen to your hard-working body. But when your heart can't pump blood as efficiently as it should, your lungs can't get enough oxygen to pass on. This is when you may start to feel short of breath. Think of it like a relay race. If one team member starts to lag, the others will struggle too. With heart disease, your heart is that lagging team member, and your lungs are left gasping for air. So next time you find yourself huffing and puffing after a little physical exertion, don't be too quick to blame your lungs. Listen to your body. It might be trying to tell you something. Remember, your lungs might not be the problem here. Your heart could be. Finally, we have nausea and sweating. Ever felt sick or started sweating for no reason? It's easy to dismiss these as just a bad meal or a hot day, but sometimes your body is trying to send a more serious message. These symptoms, often overlooked, can be signs of heart disease. Here's why. When your heart isn't getting enough oxygen due to a blockage, it sends distress signals to the brain, and the brain, not exactly sure where the problem lies, triggers a response in different parts of your body. You might feel nauseous. You could start to sweat excessively. These are your body's ways of sounding the alarm. But remember, these symptoms alone don't necessarily mean heart disease. They are simply potential signs, especially if they occur with other symptoms like chest discomfort or shortness of breath. So don't ignore that unexplained nausea or sweating. It could be your heart telling you something. So we've talked about 5 signs of heart disease today. Let's jog our memories. We've covered unusual fatigue, not just tiredness, but an unexplained, persistent weariness. We've touched on chest discomfort, a potential silent warning. We've discussed shortness of breath, more than just being winded. And finally, we've delved into unexplained nausea and sweating, signs that are often mistakenly attributed to the stomach. Remember, early detection saves lives. Listen to your heart, literally.